Hi everyone, good evening. I hope all of you are well and good. The same over here, and welcome back to one more Why Conundrum. Here we'll be discussing about one important step, and that is, see, most of you would have taken this particular tablet in your lifetime, and that tablet or capsule is pantoprazole or omeprazole, which comes under a group named as proton pump inhibitors. Proton pump inhibitors. These proton pump inhibitors are actually used for gastric ulcer. Now, most of you would have taken it, or even if you have not taken, you would have heard this particular point. And that point is these tablets has to be taken at least half an hour before food. Yeah. Everyone would have used this, but no one would have thought about why are we taking this tablet half an hour before food. PPS has to be taken half an hour, at least like half an hour. Some tablets, there will be lots of difference, like 10 minutes, 15 minutes, 45 minutes, and at least half an hour before food. We are going to be talking about why is that. Why PPIs, proton pump inhibitors, are to be taken half an hour before food. See, this is an anti-ulcer drug, buddy. We'll be talking about this particular mechanism there. We have the stomach. Yep. I hope you can see that. We have the stomach here, and we have the intestines. For example, consider here is where your parietal cell. I hope you know that. Even if you don't know, don't worry. These cells are the one which are going to be secreting the gastric acid into the stomach. Now, for example, you have taken drug, that is your proton pump inhibitor. I'm just writing P over here. You're suffering from gastric ulcer. For the treatment of gastric ulcer, you have been taking a proton pump. And this proton pump inhibitor is you're taking it via per oral route. This proton pump inhibitor gains entry into the gastric acid. We have gastric acid. But unfortunately, all of these proton pump inhibitors, or most of course, are acid liable in nature. Acid liable means whenever it is getting exposed to gastric acid, it is going to be quickly broken down. That's the reason why most of the proton pump inhibitors are actually protected with an enteric coating. The proton pump inhibitors are protected with an enteric coating, as we can see in this image. Because when it's getting exposed to gastric acid, this drug is going to get disintegrated. It will be inactivated. We cannot see what exactly is the mechanism of these proton pump inhibitors. So we are giving it in an enteric-coated form. You are taking up the enteric-coated tablets or in a capsule form, which is of course an enteric-coated one. You're taking omeprazole as a capsule form or rabeprazole or pantoprazole as a tablet form. Everything is enteric-coated. You take it via per oral route. It will gain entry into the stomach. Here is where the proton pump inhibitors are. And as we can see here, here is where your proton pump is, but the inhibitors cannot bind with the pump. So what happens? Whenever you're taking up these tablets is going to be moving back into the intestines. These proton pumps inhibitors will gain entry back into the intestines. From the intestines, these molecules is going to get absorbed into the blood vessel. Proton pump inhibitors will be getting absorbed into the blood vessel. As usual, it goes through the same whole process. Once it is gaining entry inside the blood vessel, it will be circulating throughout the body. Thereby, it gains entry into the gastric arteries, which are nearby the parietal cell. Now we have the proton pump inhibitors, which is present inside the or nearby the gastric arteries, and it is there nearby the parietal cell. Now, what is going to happen? I'm going to be drawing this particular area in an elaborate form, like what exactly is happening at this point. We're going to be elaborating it. So consider here is where your parietal cell is, and here is where your proton pump is situated. And these are your proton pumps. Proton pump. Why is it called as proton pump? Because primarily it is taking care of positive charges, which is H plus and K plus. This is named as H plus K plus ATPase pump. This is named as H plus K plus ATPase pump. So what happens from this proton pump, there will be secretion of gastric acid. Yeah, till now this is clear. Now nearby, we have the gastric arteries. As we have told, the proton pump inhibitors, which was administered for the patient, gains entry into the gastric arteries. From there, these molecules will gain entry into the parietal cells. Now here is where the proton pump is. As we can see here, here is where your proton pump is, and here is where your proton pump inhibitors. But again, this proton pump inhibitors will not bind with the proton pumps. What happens is we have a beautiful terminology to be explained here. These proton pump inhibitors will produce something named as use-dependent blockade. This will produce something named as use-dependent blockade. Use-dependent blockade means we have the proton pump, we have the inhibitors, it will not bind. Only whenever these proton pumps are actively functioning, this drug will go and bind with it. That's the name, that's the beautiful terminology named as use-dependent blockade. So these proton pump inhibitors will gain entry into the parietal cell and gets accumulated there. It will not start producing its mechanism. Now, when you have taken the food, for example, you have taken this tablet, you're waiting for like half an hour of time. You know what exactly is happening in this half an hour? This whole process, which you can see here, is what is happening there. You take up the tablet, this tablet is moving into the intestines, gets absorbed, gets accumulated in the parietal cell. That's what is happening in this time period of half an hour. After half an hour, whenever you are taking up food, when you take up food via per oral route, this food gains entry into the stomach. Thereby, whenever food gains entry, these proton pumps is going to get stimulated. Whenever these proton pumps are getting stimulated, it will try to release out acid, but it will not be able to release out acid because whenever these proton pumps are getting opened, these inhibitors will at once go and inhibit those proton pumps. Well, that's the reason why we use the terminology. It is not just a proton pump inhibitor. It is a use-dependent proton pump inhibitor or use-dependent use-dependent blockade of proton pumps. It's been happening with the help of these proton pump inhibitors. Sir, what exactly are those proton pump inhibitors? Those drug names which are ending with prazoles. Like we have omeprazole, we have pantoprazole, we have rabiprazole, lansoprazole. All these drugs, okay, these are the four major drugs to be explained. We also have esomeprazole, but again, this is one of the derivative agents. Omeprazole, pantoprazole, rabiprazole, lansoprazole, these drugs are gastric acid treatment drugs. Out of all this, the drug which has got a rapid onset of action or quicker onset of action is rabiprazole. Remember with this mnemonic, rabiprazole has got rapid onset of action. I'll repeat that. Rabiprazole has got rapid onset of action, which means there is no need to wait for like half an hour. We can start taking food within like 15-20 minutes because rabiprazole itself will increase the gastric motility. Quickly, it will gain entry into the intestines and the absorption is going to be very much faster or very much quicker. Well, that's it, guys. This is the concept of today's Y conundrum, and we'll meet up in one more Y conundrum as early as possible. Thank you. Good night.